Hello, I'm Dr. Rhonda Johnson. Today is Monday, February 26, 2024. You know, February is Black History Month, and today I'm discussing the Black-White wealth gap and health. So I'll include my links to the sources of information, but first I want to start off with some facts about this Black-White wealth gap. 1. White Americans make 73% more in annual income. They're nearly 2 times more likely to own their own homes, hold 10 times more wealth, and are 28 times more likely to become millionaires than Black Americans. The median Black American household has around $24,000 in savings, investments, home equity, and other elements of wealth. The median white household has around $189,000. This wealth gap shows how the harms of the past, meaning slavery, segregation, redlining, discrimination, live on into the present. Now, wealth is a buffer against hunger and poverty. Wealth provides access to opportunities such as a quality education, healthcare, and housing. In 2022, 17% of Black people living in the United States were living below the poverty line. Now, if you have less wealth, then you're more likely to fall below the poverty line if you lose a job or you get sick, for example. Now, poverty is closely linked to health through access to care. If you don't have enough money, you may skip medical treatments, you can't afford the co-pays, you may not be able to afford your medication. All of this can lead to delayed diagnoses of diseases and inadequate treatment. Poverty is linked to food insecurity. People living in poverty may have limited access to nutritious foods. This can lead to weakened immune systems and higher rates of inflammation and obesity. Poverty can lead to substandard housing and higher exposure to environmental pollution, which can trigger higher rates of asthma in children, for example. And overcrowding can aid in the spread of communicable diseases. Poverty can lead to increased stress, and chronic stress can increase your risk of high blood pressure, heart disease, kidney disease, and stroke. Also, people living in poverty may be more likely to work on dangerous jobs, leading to higher rates of work-related injuries. That is why it's good to know and understand how structural inequality contributed to this racial wealth gap. Now, folks, did you know there is a tool that can be real helpful in explaining this history? I don't have any relation to this tool, but it is called the Racial Wealth Gap Learning Simulation Tool. It's by the Bread for the World organization. It's online, it's free. You can download this interactive tool, and it will help people understand the connections among racial equity, poverty, and wealth. I did this exercise recently, and I learned how federal policies of the United States government created structural inequalities, especially in the areas of land and property ownership and education. For example, did you know that the policies under the National Housing Act of 1934, this law guaranteed federally backed loans to whites and legally refused loans to blacks and anyone else who chose to live in or near a black neighborhood? This practice is known as redlining, and it targeted entire black neighborhoods. Another policy that was highlighted in this interactive tool is the GI Bill of 1944. This federal program helped World War II veterans who returned from war in housing, education, loans, etc., but black veterans were excluded from many of these benefits. Folks, there's just so much that we can learn. I had this opportunity to learn from this interactive tool, as well as the RAND research that addresses these racial wealth gaps. I know that they don't teach this stuff in most schools, and the more that we learn, the more that we can be a force for change. So that is my point in bringing this message today, and I'll include the links. Take care, folks, and I hope you share this message. Feel free to comment.